Good day, class. In this video, we are going to continue the discussion on the central differentiation of Zang organs. In this video, we are going to talk about the stomach disorders and the stomach syndrome. The stomach sits in the middle jaw. It connects with the spleen. It's also a coupled organ of the spleen. So the stomach problem always accompanied by the spleen. The main function of the stomach is to receive and decompose food and water, dominates descending. So for the stomach function, it's supposed to descend, to go downwards. If the stomach got problem, it will lose the function of receiving and decomposing food. So if the stomach loses the function of receiving food, patient will present as nausea or vomiting. The food goes in, but the stomach does not want to receive, so reverse. That's nausea or vomiting. Decompose the food or water. If this function doesn't perform well, the patient will have reduced food intake or slow digestive function. The reason is decomposed food. The food you eat in goes to the stomach, but the stomach does not digest, so the food stays in the stomach for long. That's for the decomposing. Dominates the descending. This is also the direction, move downwards. If this function was affected, the patient will present with vomiting or nausea. The first one, the stomach qi deficiency. The stomach qi deficiency, when you see the manifestations, it is very similar to the spleen deficiency. Stomach qi, firstly qi deficiency. So the patient will have qi deficiency symptoms, which are lassitude, short of breath, reluctance to talk. Poor appetite, the dull stomach ache, gastric discomfort, distension. As you can see, all these symptoms you also can see in the spleen qi deficiency, although sometimes we use different descriptions, such as the abdominal distension and gastric distension. Although we use different descriptions, but when you think about the manifestations, they are quite similar. We actually cannot distinguish from what's the difference, especially in clinic, what's the difference between a gastric distension and abdominal distension, because the manifestations are almost exactly the same. So as you can see, these manifestations are very similar to spleen qi deficiency. The patient also has pale tongue with a white coating. The pulse also can be weak. So what's the difference between a stomach qi deficiency and spleen qi deficiency? The most important difference is the stomach. The main function of the stomach is receiving and decomposing food and water. So in this situation, if the stomach got problem, it will represent mostly in this function. That's why the patient will have reduced food intake, distension or pain. Mostly, the symptoms will centered around the stomach or the abdominal, upper abdomen area. When you compare with the manifestations of the spleen qi deficiency, there's one key aspect: loose stool. For stomach qi deficiency, we don't focus on the stool, but for spleen qi deficiency, we will focus on the stool. The reason is spleen qi deficiency will result in dampness in the body. The dampness is actually an extra water retention in the body. The water retention in the large intestine will result in the loose stool. So the spleen qi deficiency will result in the dampness, which results in the loose stool. Stomach qi deficiency mostly refers to the manifestations in the abdominal area plus qi deficiency symptoms. So that's the difference. Although most of the condition, the spleen qi deficiency, also accompanied by the stomach qi deficiency. In other words, a stomach qi deficiency syndrome always accompanied by spleen qi deficiency syndrome. So in clinics, sometimes we always said that the patient suffer from spleen and stomach qi deficiency. Stomach yang deficiency. This is also very similar to the spleen yang deficiency. The only difference is we focus on the stomach function decomposing. Yang deficiency will cause the coldness, cold sensation, vomiting of watery fluid, perfumed fluid, deficiency cold symptoms. Apart from the cold sensation in the stomach ache, the patient also may present with cold limbs, cold hands, cold fingers, and the stomach ache can be relieved by warm. The causes of the spleen yang deficiency can be from the improper diet, such as eating a lot of ice cold stuff, or from the very cold herbal medicine. The patient will present with slow digestive function, or nausea, or a lot of saliva coming out of the mouth, especially after eating, after meals. When we talk about stomach yang deficiency, we also compare with spleen yang deficiency. As you can see, the manifestations we mostly refers to the abdominal symptoms. Stomach insufficiency. Stomach insufficiency. The symptoms the patient may present with stomach ache. Because this is a deficiency, so the stomach ache is not severe. Dulls the stomach ache. Hunger with no desire to eat. Because of insufficiency, so the patient will have deficiency heat in the stomach. The deficiency heat can help to digest food. That's why the patient can feel hunger, but this is a deficiency syndrome, the stomach deficiency, which means that the stomach causes poor digestive function. So the patient doesn't want to eat, because when they eat, when the food goes to the stomach, begin to increase the burden of the stomach. The patient will feel worse. Dry mouth and dry throat. That's because of deficiency. That's the fluid deficiency. Dry stool, scanty urine. That's also due to the deficiency. The patient doesn't have enough body fluids in the body. The tongue is very different from stomach qi and yang deficiency. The tongue is red because the deficiency, the patient will have deficiency heat. So the key points: the patient have dull stomachache, or sometimes the patient even has burning sensation. That's also due to the deficiency. No desire, hunger, but no desire to eat. Doesn't want to eat. And deficiency symptoms. Apart from the symptoms that we have mentioned here, a dry mouth, dry throat, dry stool, scanty urine, what other deficiency symptoms can you think of? Such as the five hot sensation with the five hot, the palms, the soles, and the heart. So the feverish sensation in the palms under the soles is also the sensation of deficiency symptoms. Those three syndromes are the deficiency syndromes of the stomach. Stomach also have excess syndromes. The food retention is one of them. The food retention affects the function of the stomach. So the patient will have distension feeling, stuffiness, pain. It can be either the patient doesn't need to experience all of them. The food retention, in order to diagnose food retention, the patient should have a history of improper diet. The food retention will have a thick greasy coating. So that's the key manifestations of food retention. You can ask about the history. The patient will have an improper diet history. From the vomiting or from the nausea, the patient can experience foul smelling. That's also another sign of food retention. So the smell from the mouth doesn't smell good. That's also another signs of food retention. The stomach fire. The stomach fire and the stomach deficiency. The difference between the stomach deficiency and stomach fire, the patient also can have a burning sensation. The stomach deficiency, the patient also can have, but from the deficiency, it's not that severe. Stomach fire is a kind of excess syndrome. Stomach deficiency is a kind of deficiency syndrome. So from stomach fire, the patient will have manifestations in the stomach, which can be burning sensation, gastric upset, acid reflux, thirsty with desire to drink, scanty dark yellow urine. That's because of the fire can consume the water fluid. For stomach insufficiency, the patient also can have scanty urine. But the causes of these two scanty urine are different. One is due to deficiency in fluid. The body does not have enough fluid. The scanty urine from the stomach fire is due to the fire consuming the fluid and then results in the scanty urine. Constipation is also because of the fire. The fire can block the qi circulation. The fire also can result in can consume the fluid, result in fluid deficiency. That's why the patient will experience constipation. Foul breath, swelling, and pains of the gum bleeding. This is the second time that we mentioned about the gum bleeding. So from the spleen, we also mentioned the gum bleeding. The causes of these two are very different. How do you identify the gum bleeding is from spleen deficiency or from stomach fire? Most importantly, from the tongue. The gum bleeding due to the stomach fire, the tongue will be red. It will have a yellow coating. The gum bleeding due to spleen deficiency, the tongue will be pale. So that's the key manifestations, how to distinguish with different surgeons. Also the pain of the gum. In future, we also will know that the gum refers to the upper gum. The lower gum more related to the large intestine. The upper gum more related to the stomach. The reason is because of the meridian. The stomach meridian enters the upper gum. The large intestine meridian enters the lower gum. The patient will have a heat syndrome. So that's the stomach fire. Cold retention in the stomach. The stomach needs to digest food. It's the function of receiving and decomposing food. When you digest food, it is very similar when you cook your food at home. You need a fire, you need a heat to cook your food. If you put the food in a pot and then you put in a fridge or freezer, the food will not be cooked. So in order to cook the food, we need a fire. Same as the stomach. In order to digest food, we need a fire. We need a stomach yang. The cold retention. The coldness stays in the stomach. Will reduce the yang, will reduce the qi in the stomach, will result in food retention. The patient will present with varieties of manifestations due to the poor stomach function. The patient can present with such as the distension in the abdomen area. The patient also can present with waters in the stomach. They can feel some water. That's from the distending feeling. The cold sensation. This kind of stomach ache also can be relieved with warmth. Essence of thirsty. The patient won't feel thirsty because the cold retention, the coldness will not consume the fluid. So we will have fluids in the body. That's why the patient will not feel thirsty. If vomit watery fluid, that's because of the coldness of lumps. So the stomach with a cold sensation. This cold sensation can be the patient's symptoms. It also can be a sign. So when the practitioner palpate the patient, sometimes the practitioner can feel cold feeling in the stomach area. This is a sign of the cold sensation or cold manifestation. Plus, the symptoms of excess coldness. So these are the key manifestations of cold retention in the stomach. In this video, we have introduced some common disorders of the stomach syndromes. When we study the stomach syndromes, especially for the similar syndromes, we need to distinguish the differences from the spleen disorders and the stomach disorders. Briefly, the stomach disorders will more focus on the stomach problem, will more focus on the abdominal problems. The spleen disorders can vary from different problems, such as the rise of the qi, the location, the internal organs location, spleen qi sinking, that kind of problem. It also can be the digestive problem, but the spleen problem also will result in the stool problem. So the patient may present with abnormal stool. So these are the discussion on the spleen and stomach. Thank you for your attention.